I am Tonya Caruso. Welcome to Comcast Newsmakers, helping senior citizens to stay in their homes. Joining us in our studios this half hour is Danielle Bodner. She is an enrollment specialist for Life Pittsburgh. And thank you so much for coming in and talking with us today.
Thank you for having us.
This is really a lifeline to so many seniors. And let's begin by telling folks at home exactly what you all do.
Well, Life Pittsburgh stands for Living Independence for the Elderly. The whole goal, the whole mission of this program is to keep seniors in their home for as long and as safe as possible. This is basically an alternative to nursing home placement. It's for individuals that are 55 years and older who are residing in Allegheny County. Our program handles the western portion of Allegheny County, but there are multiple other life programs throughout Pennsylvania. And the whole goal is to catch individuals early. You know, we want them to enroll into our program as soon as possible so we're able to maintain them at home.
So if there is a senior sitting at home, or maybe someone's parent, or what are the eligibility requirements to take part in Life?
Well, one is they do have to be 55 years and older, again residing in our zip code area, and then they also have to be or need some sort of assistance to stay at home. So maybe they're walking with an assistive device, or forgetting to take their medications, forgetting to go to the doctors, or not able to get to the doctors. We're able to do all of that for them.
And how does it work from your end, and what sort of services do you provide, and how often does someone go into the home to assist with these?
Sure. The main part of our program is we have what's called an adult day health center where individuals go. There's a whole team of medical professionals there. There's a primary care physician on site. There's nurses, social workers, a dietitian. They get a hot meal while they come. They get out of their home and get to socialize with other people. We all know how important that is for their well-being. And we coordinate their transportation, so we provide all of those services for them. Now, coming to the center is all based on needs. So some people come 1 day a week, some people come 1 day a month, some people come 5 days a week. It's all based on the individual's needs. We also have home health care. So like you were saying, we do have our own team of home health care professionals that can go into the home. They're prompting medications. They're preparing light meals. They're making sure that they're safe in their home. So it's just this comprehensive program that meets all of their medical as well as social needs.
Right, and you've mentioned a couple of times about 55 is the starting point, and you want people to register as soon as they can.
We do, because the nice thing about this program is we grow with them. So maybe they're not receiving a lot of services in the beginning, but as their needs change, we grow. So maybe we are able to implement more and more services to keep them safely in their home. Right. The other nice thing is this is an absolutely free program for them as long as they qualify. This is a government-funded program, so it's covered through Medicare as well as Medicaid dollars. So if they just want to reach out and call us as soon as possible, and we can walk them through the entire enrollment process.
Right, and it's so important, and since you mentioned that, we are putting on the screen website and phone number where folks at home can go for more information about the program. And you've touched on this a little bit. What does this mean for seniors to be able to stay in their homes?
I think that, you know, oftentimes I think of people that I've walked through the enrollment process. You know, they're always telling me, I wish I knew about this earlier. You know, they told me their entire life they wanted to stay at home. Please don't put me in a nursing home. And that's where we come in. We can provide all of the support services to do that.
And so when you see this, and when you're at one of the centers or you're seeing someone get care in their home, how do you measure your impact, or can you even begin to measure your impact?
Oh my gosh, we're told daily that if it wasn't for you, I would be someplace else that I don't want to be. You know, these individuals are receiving everything that they need, and they're getting out. They're always telling us how wonderful the food is. The food is absolutely wonderful. But if you think about it, some of these individuals, that's the only meal that they're getting. It's also the only meal that they're sitting down with other individuals.
And having a great time at that. We thank you so much for coming in and talking with us today. Such an important service. Thanks for your time.
No, thank you so much.
You're welcome. I'm Tonya Caruso. Thanks for watching Comcast Newsmakers. We'll send you back now to HLN.